To discuss the systemic racism and public health crisis, as well as strategies and best practices to address it, we are pleased to have a prestigious panel of experts with us today. But before we hear from them, I want to thank NIHCM's President and CEO, Nancy Chalkley, and the NIHCM team who helped convene and curate today's event. In addition, you can find biographical information for all of our speakers, along with today's agenda and copies of their slides on our website. We also invite you to live tweet during the webinar today using the hashtag #RacismAndHealth. We will take as many questions as we can after our presentation. I am now pleased to introduce our first speaker, Dr. Camara Phyllis Jones. Dr. Jones is currently an associate professor at the Rollins School of Public Health at Emory University. A past president of the American Public Health Association, Dr. Jones' research is some of the definitive work on racism in public health. She is going to help us to understand and show us how racism and privilege harm health in our society and the actions we can take to bring about change. Dr. Jones?
Thank you very much. And I'm delighted to be part of this webinar. I would like to, what I'm going to be doing is sharing a story and then a definition and some frameworks very quickly to help us understand that it's important to name racism, and then we have to go beyond that and move to action. So the story that I'm going to tell you is one of my allegories based on my real life experience. This one that I call Dual Reality, a restaurant saga, has the moral of racism exists. It's based on an experience I had when I was a first-year medical student. One Saturday I was in my apartment studying, because I was very diligent, very studious. And about mid-afternoon, some friends came over, and rather than distracting me from my study, we all got to studying long and hard, and it got late, and we got hungry, and I had no food in the apartment. Well, that was typical for me. My friends understood, so they were like, never mind, Camara, let's go into town and find something to eat. So we did. We went into town, we found a restaurant, we went in, we sat down, the menus were presented, we ordered our food, the food was served, and here we are eating. Not a very remarkable story yet about racism, but as I sat there with my friends eating, I looked across the room and I noticed a sign, and that sign was a startling revelation to me about racism. So now I've intrigued you, and you're like, okay, Dr. Jones, what did the sign say? What did the sign say? The sign said, open. Now, I know I may have lost some of you, so let me recap what was going on. Here I was sitting in a restaurant eating. I look across the room. I see a sign that says open. Well, if I hadn't thought anything more about it, I would have assumed that other hungry people could walk in, sit down, order their food, and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, because of the hour, the restaurant was indeed closed, and that, firmly closed, and that other hungry people just a few feet away from me would not be able to come in, sit down, order their food, and eat. And that's when I understood that racism structures open, closed signs in our society, that racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it is difficult for any of us to recognize a system of inequity that privileges us. So, for example, it is difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for most Americans to recognize our American privilege in the global context. But those on the outside are very well aware that there's a two-sided sign going on, because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, That's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, then you can even talk to the restaurant owner who is, after all, inside with you. And you can say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You will make more money. And, oh, the conversations we could have. Or maybe what you'll do is pass through the window. Or maybe you'll try to tear down that sign or break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat, because you'll understand something about the two-sided nature of that sign. And actually, this story is useful to point out that, yes, racism is creating two-sided or multi-sided signs. It's structuring dual or multifaceted realities, and it's good to ask the question, how could people who are born inside the restaurant know something about the two-sided nature of that sign? I once had a 3-hour conversation after asking that one question, so there are many ways to know. But it's also important for us at this time to recognize that things in our society in the past 9 weeks have made people who were born inside the restaurant, some of them have glimpsed the other side of that sign. Maybe the air conditioning went on high and caused the sign to flutter. Maybe a brick came through that window and caused a little breeze. But for those people who are now understanding that there's a two-sided sign going on, it is important for us to affirm that Black Lives Matter. It's important for us to put the words together, structural racism or systemic racism. But if we just say a thing, then 6 months from now, we are at risk of forgetting why we said that thing, because the somnolence of racism denial in our society is so seductive. So what I need to tell you is that we need to not just say a thing, we need to start acting, to tear down the sign, to take the lock out, to take the door off the hinges. Because if you start acting, then you will not forget why you're acting. But I owe us all a definition of racism. So when I say the word racism, I'm clear that I'm talking about a system. I'm not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, although it manifests in those ways. But I'm talking about a system of power. And a system of doing what? It's a system of structuring opportunity and assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on the social interpretation of how one looks, which is what we call race. And what are the impacts of this system of structuring opportunity and assigning value based on so-called race? Well, when we do talk about racism at all, we understand, most of us, that it unfairly disadvantages some individuals and communities. But every unfair disadvantage has its reciprocal unfair advantage. So racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about, because it makes some people, especially some white people, uncomfortable. And if you're feeling uncomfortable right now because of, me bringing unfairly advantages up, I used to say, shake it off, I'll tell you more stories. Now what I say is, if you're feeling uncomfortable, you need to lean into that discomfort, because for all of us, the edge of our comfort is our growing edge. But there's a third impact of racism that many of us don't recognize, and that is that racism actually saps the strength of the whole society through the waste of human resources. So when we affirm that Black Lives Matter, it's not just that Black Lives Matter. They're precious, they are genius, they are leadership, they are generosity and creativity and love. And when we constrain Black lives and Indigenous lives and the lives of other people of color, either slowly by not vigorously investing in the full excellent public education of all of our kids, or quickly snuffing people out by leaning on their necks in 8 minutes and 46 seconds, then it's not just a problem for the person whose genius has been lost, or even for the family or the community. It's a problem because that loss is sapping the strength of the whole society through the waste of human resources. I would like to be able to say that I would have time to share my Gardner's Tale allegory, which describes 3 levels of racism. I do not, but I highly recommend it. The moral of that story is that we must address structural racism, even as we also address personally mediated racism and internalized racism. But even if we don't address those, we must address structural racism, institutionalized racism, if we want to set things right in our society. And when we do, the other levels will take care of themselves. I also want to just share with you very briefly way of understanding, because it's important to name racism, but we must move to action. So the next two steps in that trajectory are asking the question, how is racism operating here? And then organizing and strategizing to act. So how is racism operating here? It's a legitimate question. Racism is not a cloud or a miasma we can't get a handle on. It is a system with identifiable and addressable mechanisms in our structures, policies, practices, norms, and values, where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, what's on the agenda and what's not. Policies are the written how of decision-making. Practices and norms are the unwritten how of decision-making, and values are the why. And during the Q&A, I would love to take you through how that question can help us identify mechanisms of racism that are manifesting right now in the disproportionate impact of COVID-19 on communities of color. But just briefly, I want to give you one more thing. I define health equity, in a three-part definition. What is it? How do we get there? And how is it related to health disparities? Right now, I just want to lift up three principles for achieving health equity, which are valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. So then what are we to do? What can we do today? Well, we need to actively look for evidence of two-sided signs. Is there something differential going on by race, by language, by immigration status, by gender, by zip code? We need to burst through our bubbles. We all live in a bubble of experience, to experience our common humanity on the other side of town, to recognize that just across town there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to be interested in the stories of others, and then believe the stories of others, and finally to join in the stories of others. I'm so heartened by the mobilizations we're seeing right now in this protest movement, in this assertion in this movement for Black lives. We need to see the absence of. When we sit at this decision-making table, we need to look around and say, who is not at this table, who has an interest in this proceeding? And our job is not just to represent their interests. Our job is to create space and find them a way to the table. Who's not at the table, what's not on the agenda, what policies are not in place. We need to reveal inaction in the face of need, because that is how structural racism most often manifests these days. And all of the actions are not just on the part of those inside the restaurant. Those of us on the outside need to know our power, to recognize that action is power, and especially that collective action is power. So I'm so delighted to have been able to share these quick thoughts, and I turn the table back over to Sherry to bring on our next speaker. Thank you.